SmellMedica.com TV, welcome. Dr. Stephen Mulholland here in Toronto, Canada, and we're going to be talking today about Botox. Botox, in the last 15 years, probably no single product has done more to enhance patients' awarenesses of what they can do without surgery to achieve a natural facial rejuvenation. Botox can shape the brow, elevate the cheek, contour the neck, improve lines and wrinkles. Just so versatile in our ability to deliver what you want, fresh, natural, youthful, rested appearance. So let's take a look at one patient's story and experiences with Botox.
Coming to you from Queen and John, it's Cityline with Marilyn Dennis.
Welcome to the show. It's our Looking Good special. We got three experts. We sure do. We've got Dr. Steve Mulholland here. Let's hear from Steve, cosmetic surgeon. Over there, we've got Derek Selby and Bill Rowley. A couple things I want you to do. I want you to get your pen and pencil out and paper, because Steve's going to talk about a variety of things, like you'll take any question.
Any and all questions
looking
your best.
Looking your best, okay. And then we have a show with you, not this Friday, but the following Friday, yes. A whole hour with you. So there we go, 416-870-7716 or 1-800-295-LINE. We got lots going on today. I believe we have a good-looking audience. Yes, we do. And we're ready to roll. The first take. Heather Muir had a dent in her forehead. I'm not kidding you. It's something that gets deeper and deeper the older she gets. So she went to see Dr. Steve Mulholland to see what could be done about it. Watch this.
Heather, how long have you had the dent for?
I've had the dent since my early 20s, and I just noticed it forming then, but it's gotten deeper and deeper and deeper, and now I just can't stand it.
So, Dr. Mulholland, what do you see?
I see a young lady who, in her very early 20s, really didn't have much of a dent at all. But she had a hereditary predisposition. Her parents had deep, deep furrows in their forehead. And even in her early 20s, you see a mild line forming where you wouldn't normally. Once we got to her early 30s, she started to have a very, very noticeable crevice from overactive frown lines. Again, a hereditary predisposition. Her parents had it, she got it, doubly bad. Now we have a young lady who in her mid-30s, even when she's not frowning, has a permanent indentation, almost to the point where when you look at it, it almost looks like a scar or a bit of a deformity, because she's been frowning so long, she's left a change in the collagen of her skin, an indentation.
So what are you going to do about it?
Our plan is to, first of all, put those frown muscles to sleep, to use a little bit of Botox, a little paralyzing substance injected only into the muscles of the frown, so she can't do that anymore. But even when we do that, we won't have corrected her indentation. So we're going to take substances from her own body, some fat, lay some fat in the base of that deep furrow to soften it, and then take a little bit of injectable filler, some Hyliform or some Articol, to give her as smooth a possible result. And that is what I would anticipate she should be able to see at the end of our procedure.
Dr. Mulholland, now it's the Botox?
Yes, I've wiped her skin clean with alcohol, and we're going to put the Botox into her very active frown lines. Heather, give me a good frown. Very active muscles. I'm going to insert little Botox on either side of her frown line, and that will go into the muscle and put it to sleep. Now, Heather, it takes a few days for this Botox to take effect, 3 to 5 days. During this period of time, I don't want you to rub your forehead, and I want you to try and avoid excessive exercise where you get a lot of pressure, back pressure. So no straining, no lifting, no physical exercise for about 2 or 3 days. I'm going to hold a little pressure there now to minimize any risk of bruising. And we're going to do the other side.
You should have heard the camera crew going, ow! Everybody has different pain thresholds, so.
Well, interesting, your camera crew's all male, but I didn't hear every women go, ow.
Yeah, they're going like this, and we were like this in the audience. And you guys are just, you know, Oliver, come on, you guys. Okay, let's talk about genes. This dent in her forehead is hereditary. It plays a big role in the fact that she has it, but the fact that something can be done is terrific.
Yeah, interestingly, there are pictures of Heather's parents, and we were kind not to show them today, but they had big, deep grooves in their early 30s as well.
Yeah.
And unfortunately, we can blame or fortunately, blame our parents for the ravages of age. When you look at the gruesome consequences of growing old, usually you can look at your mother,
it's gruesome
the mother's
sometimes.
mother, your father, and you can see those jowls, those cheeks, those eyelids that they've passed on to you.
Or the nose.
Or the nose.
Or the nose, because is it true that the nose and the ears keep growing?
They do mature somewhat in terms of width, but their overall length and proportion is generally fixed by about 18 to 20 years old.
About 18 to 20 years old.
But the skin on top of it can change. So you get sometimes the W.C. Fields nose later in life, and sometimes the ear gets more cauliflower.
So when someone is not happy with what they have, do you recommend that they bring pictures in from their parents as well as pictures from their youth, just to see how much it's accentuated?
To some extent, I always use the patient's own pictures from when they were 25, 35, and 45 to try and create a beautiful version of themselves.
Okay.
Because after surgery, the last thing you want is someone to say, wow, you look different. Who did your facelift? You want someone to say, you look great, you look refreshed, you look rested.
Did you do something with your hair?
Yes, I did personally.
No, you did. But that's what people do, just something with your hair.
Yeah, and if you can attribute it to that, that's wonderful. And usually that's what should happen.
Yeah.
And then if you bring in pictures of the parents, you can show them that that's who to blame right there. You know, we can't trade our parents in. Unfortunately, the damage is done. And it happened at the time of conception.
No, we love parents. We love parents. And I know I'm going to hand my son down a couple of things. You can't see it right now because I've had them all changed. But he will inherit some of those things. But the point is, that's the kind of research that you do. Things are hereditary. You have to accept that. But what's remarkable is things can be modified, which is terrific.
Yeah, and especially, for example, the segment today with Heather. If we can, it used to be 5 years ago, we would jump right into surgery.
Yes.
Now, generally, I talk about a step ladder, and the first 4 or 5 rungs on that step ladder have no knives involved, which appeals to many patients because
that is interesting.
You know, very few people in Canada are going to have a facelift.
Right.
But everyone wants beautiful skin.
Yeah.
Everyone wants to have beautiful skin.
Okay, well, here we go. Here's Steve at work on Heather's surgery. We want you to watch this, but not the cameraman. You'll get queasy.
And it's time for your surgery. Are you nervous, excited?
I'm both. I am nervous. I had a little bit of trouble sleeping last night, but now I'm excited now that I'm here.
So how does it look so far?
Okay, well, since the Botox, I love being on camera with no makeup. Since the Botox, it looks a lot better, so I'm really looking forward to seeing what he can do with the article. Yeah.
All right. Dr. Mulholland, what are we looking at here?
What we're looking at, Patrick, is the beginning of some purified fat. The first step today, we're going to take some fat from the patient's thigh, an area where she doesn't want it and doesn't need it. We're going to purify that fat, and we're going to inject it under the depths of her forehead furrow. We're going to add a little bit of articol to give her a nice, smooth appearance. And we put a little freezing in so she doesn't feel this, and we move back and forth, and the fat gradually accumulates in the syringe. What you're looking at is the creation of the purified fat cell. And if you look at this, there is no more blood, there is no more serum, just thousands and thousands of little fat cells. In this purified form, when we inject it with gentle microfat techniques, we can get those little fat cells to live with great predictability, and that's why this will likely last this young lady for years. Now the articol. This, Patrick, is the articol. This is the second injectable substance we are going to put in this patient's furrow. I do this very, very superficially, inside the superficial depths of the skin to add a little bit of steam pressing or a little bit of smoothing on top of where the fat went. And now we'll lay down some fat right there. Some articol on top of the fat right there. You have no wrinkle anymore. Completely smooth.
Cityline, it's a Looking Good special. Dr. Steve Mulholland is right here, and now it's time to see the result. Here's how Heather looks after it's all done.
So where are we now, Dr. Mulholland?
Well, as you can see, Patrick, Heather's had a wonderful result. She's completed her microfat, her articol, and the photofacials. And as you can see, she's had an astounding, well over 90% improvement in her rather deep frown line.
So what does she need to do to maintain this?
What I'd recommend at this point is about 3 times a year, every 4 months, Heather would come in for some Botox. The Botox would put to sleep that tendency to want to crunch the skin, and that should preserve this nice smooth result she's got. Perhaps some good medical skincare products and some photofacials to continue to enhance and improve upon this already lovely skin that she's displaying. And as you can see, she's cut her hair and she's for the first time showed off her forehead rather than hid it.
What do you think?
I love it. I love it. It's the best thing I've ever done for myself. I feel so good when I look in the mirror. It's a massive, massive difference.
Okay. We're gonna put Heather's phone number up, so if you're not doing anything Saturday night. How do you feel?
I feel great. I feel great. I used to, whenever I looked in the mirror, it was the first thing I would focus on is my dent. And whenever I got pictures back, I would just look at my dent.
Yeah.
And now I feel great.
See, the funny thing is, you and I worked on the foster parent special together
Right.
a couple of years ago for Foster Parents Canada, and I'd never really talked to Heather that much before. And happy, but with that, you had like this furrowed brow kind of.
It's true. And what people are saying to me now is, you just look more relaxed. Are you, what are you
Yeah.
doing? You look stress-free, you're more relaxed.
Yeah, and that was his point, right? That you,
Exactly.
you don't know what it is.
Exactly,
Yeah.
right.
Well, did you like the fact that when you first started, you said, I can't work out for a couple of days? That kind of gives you an excuse not to work out.
Yes.
Yeah, I got to rest. I can't work out for a couple
I'm just
of days.
going to have to recline.
That's right. That's
Like
right. Well,
there,
listen,
so-
I think you look fantastic.
Thank you. Thank you.
It suits your personality. Okay, so I want to talk a little bit about maintenance, and one of the words, and we're going to talk about it a week from Friday because you're on for the full hour. Can you guys give me the date from a week from Friday, just in case I, make it on the 26th? He's here, July 26th for the full hour. That's Dr. Steve Mulholland. Just quickly, because we'll talk about it more on the 26th. Photo facials. You said that was part of her maintenance. What does that mean?
Photofacial is taking light, gentle pulsed light,
Right.
and radio frequency waves and passing them through the skin so that we don't create any downtime. It's easy to take some lasers and give you a lot of weeping and crusting and oozing, but the photofacial is designed to be done about every 3 weeks. You do 4 or 5 sessions and you really can turn back the clock on your
So what is it? It just takes, repairs any of inconsistencies in the skin?
It repairs
like
broken
veins?
capillaries, veins, age spots, sunspots, pores, and we do it for the whole face or the décolletage of the chest or the hands, and it really just turns back the time on your skin. And it's one of those first 3 or 4 stepladder rungs that you can grab onto while trying to look your best without jumping into an operative experience.
And how often would you have a photofacial? Because you're glowing, Heather. That's always good to do, isn't it? It's good to glow. No, she looks great.
She is a glower.
She is a glower. Well, it comes from within. I know that.
Right.
But
we're working on internal photofacials too, but that's usually the psychologist.
I give some gift certificates to some people I know. But just taking what you have on the skin, the imperfections on the skin, is it once a month?
Once a month, yeah. About once a month you come in and the treatment's performed. Takes about 30 to 40 minutes and you go back to work.
Okay, very good. All right. Well, listen, again, well done. Thanks for letting us follow you, because we're nosy people here at Cityline. More with Dr. Steve on July 26th night. Thanks to Bill and to Garrett. Have a great day, everybody. Thanks for watching Cityline. See you later.
Wow, amazing that you can achieve so much with such a little medication injection, Botox. Wondering what it can do for you? You can check out further on spamedica.com or come in and see us. Looking forward to help you achieve the rested, youthful look that you've been desiring.